So there were several trials in gene therapy reported for spinal muscular atrophy. There were additional reports from START, so the first trial with some long-term results. There were some data presented from STRIVE US, so the confirmatory trial in type 1. There were also data presented from SPRINT, which is the pre-symptomatic trials, and in the last session there was some data presented from STRONG in type 2. What I personally take from all these trials is that gene therapy works, but it works better if you give it early. And when you compare the data from START and the data from SPRINT being the pre-symptomatic trial, there is no matter of comparison. These patients from SPRINT are doing much better. And in STRONG, it seems that it's the patients who are the younger patients who are doing, who have the best results in the trial. And patients who are aged like 5 or 6 years when they enter into the trial have not the same prognosis than patients who are 10 months. So all these data go in the same direction. We should treat the patients as soon as possible.
We have seen communications and posters about the longer follow-up of patients treated with the gene therapy, and it is quite interesting because it's not just that the evolution of the patients is quite different of the natural history, but with a longer follow-up we see that the response is maintained over the time. So patients treated very early used to be in a very good condition if we compare with those who are not treated, because the natural history of the SMA we all know that is very bad. But with the patients who are treated now for a longer term, when we see the motor functional scales, we see that they are quite stable.
Regarding the gene therapy clinical trials in SMA, there are different trials. There's a trial with pre-symptomatic patients, very, very young newborns, who get treated before onset of the disease. There is a trial, this was the first trial with gene therapy with the early symptomatic patients, and a trial with older patients between up to age 5 with intrathecal delivery of the drug, whereas in the younger patients it's delivered intravenously. And throughout all the trials there is data that there is remarkable improvement with the gene therapy. So usually a patient with SMA1 never sits, and now the patients are sitting and some are even walking. This is unseen in history. There was a talk on a trial with older patients with gene therapy up to age 5. This was preliminary data, and it also shows considerable improvement compared to the natural course of the disease. However, the older the patients get, the more they might have antibodies. So this has to be taken into account. But we will have several options soon for doing therapy in SMA. And this is really wonderful, because for many, many years I always told my patients, you have to do physiotherapy and we see again in several months. And now there are so many options we can discuss.